Welcome to the LearnSkin podcast with Dr. Raja and Dr. Hadar, where they discuss all things skin. Skin is fascinating because it affects us in so many ways, like our health, psychology, and how we connect with those around us. This podcast delves into the art and science of skincare. A short disclaimer before we get to the good stuff. Dr. Raja Sivamani and Dr. Hadar Levtov are board-certified dermatologists. This podcast is meant for educational and informational purposes only. All opinions shared do not express the views of LearnSkin. Neither this podcast nor any information contained within it are a substitute for professional care by a doctor or other qualified medical professional. This podcast does not constitute medical or other professional advice or services.
Hey Raja, how are you today?
I'm doing great, Hadar. Sounds like another podcast, and today we're talking sleep.
Yes, I know. I just came back from a full day of clinic, and I can't wait to get a good night's sleep. And I'm sure everybody finishing their day at work or coming back from school are sort of ready for sleep. But there are some people in the population who may not enjoy sleep, and some of them may even have skin disease like atopic dermatitis. So I think today we have an uber expert in eczema in general, and she's going to talk to us about sleep. Am I right?
That's right. That's exactly right. I'm going to just do a small intro, and we have Dr. Vivian Shi. She is a board-certified dermatologist and pretty unique background. She's an assistant professor at the University of Arizona within the Division of Dermatology. She's the director of the Eczema Specialty Clinic, director of the Hydradenitis Suppurativa Specialty Clinic, and director of the Inflammatory Skin Research Fellowship Program. So she's been seeing a lot of conditions that have inflammation, but along with that is the whole point that there's psychological distress and sleep disturbances. And we're happy to welcome you, Dr. Shi, to the podcast.
Hello. And a very good friend of the program, we should add.
A dear friend to all of us. So yes, this one's a real treat. So Vivian, can you get us thinking about sleep? So what is it that you've noticed among patients when you think about sleep when it comes to skin conditions?
Yeah, so sleep is really important, not just for people with skin conditions, for everybody as well, right? It's what drives us, gives us energy and concentration and focus throughout the day. And sleep is especially disrupted in chronic inflammatory disease patients. These are the patients that we care for on a day-to-day basis. They suffer a lot, both from the lack of sleep as well as their skin condition. And also, the lack of sleep is pervasive, not just for the patient themselves, but also significantly affects the quality of life for their families and the loved ones.
Yes, absolutely. If that kid doesn't sleep, I don't think anybody in the house can sleep. And it's very interesting that there's some research done on the specific connection for kids and adults with atopic dermatitis. Maybe you can speak about that a little bit. Are people with eczema really have more sleep disturbance than the average population?
That's what it seems like. Up to 80% of the kids and nearly 90% of adults with atopic dermatitis actually suffer from insomnia. It's another word for difficulty both falling and staying asleep. So you can imagine when this many people with atopic dermatitis is not sleeping well, these fatigue-related issues really impacts the quality of life, both in terms of productivity and interpersonal connections. We know that people who suffer from sleep issues is not just the children and adults with atopic dermatitis, but also their family members as well. Especially parents of kids with atopic dermatitis, there's a lot of dependency and fearfulness that are relevant, and these dependency and changes in sleep can lead to cognitive development issues and learning disabilities and even behavioral problems during the daytime, such as like impulsivity and autism and even attention deficit and hyperactive disorders.
Yeah, I mean, I can't imagine not only being an itchy kid and maybe with rashes that sometimes even affect your face so you can't even cover it, and then having a lack of sleep on top of it and irritated parents because they couldn't sleep. I mean, it just sounds like a nightmare.
It is a vicious cycle for everybody involved, definitely. And as healthcare providers, we are kind of the gatekeepers in helping these families and patients improve their quality of life, not just on the skin level, but also just kind of get them, some rest time. And so that's really powerful stuff. We can figure this out all together.
Now, when you talk about rest time, Vivian, can you talk a little bit more about the quality of sleep? So when someone has atopic dermatitis and they're constantly itching, when they're finally able to get to sleep, is their sleep as deep or is there more at play while they're sleeping? Are they constantly moving? Is there subconscious itching? What's going on for those patients that are dealing with itching that's there at a basal level?
That's a really relevant question, Raja. So, at the surface, both the duration of sleep as well as the sleep latency, meaning how long it takes for people to actually fall asleep, are both disrupted. The scratching behavior occurs in both REM sleep and non-REM sleep. And if you look at the sleep study for folks with atopic dermatitis, every stage of their sleep is affected. And so it's just interesting because you think that, well, if the patient is scratching during a flare, maybe when their disease is well controlled, this goes away. But that turns out to be not so true because even during disease remission, we now know people are still having difficulty sleeping. And this is because of the learned behavior pattern, learned sleeping pattern that really developed during active disease flare. So it tells us, it really hits home that early and aggressive and efficacious management of atopic dermatitis that involves improvement of sleep really, really changes the patient's the projection of their development and sleep behavior later on in life.
And Vivian, there's something, and this is something that you taught me. When we think about atopic dermatitis, there's obviously multiple different variations and variants. And when it comes to the disease affecting the head and the neck, one thing that I know that you've spoke about in the past is that can affect sleep even more. Can you talk a bit about that?
Yeah, the head and neck is interesting because during the nighttime, there's a lot of things that happens to the skin and immune cells in the head and neck that can affect sleep. So for example, the blood flow in the skin and the head and neck area is very unstable at night. So you get this flushing, swelling underneath the skin that brings inflammatory cells and other molecules that causes itch at night. So helping to calm this temperature of the skin as well as fixing the skin barrier of the head and neck area at night is really helpful to kind of reset the circadian rhythm and helping people falling and staying asleep. And there are several things we can do. For example, we know that the skin barrier dysfunction is kind of the most effective at night. There's least amount of oil production on the skin, and the water loss is the most extensive at night, and it's really dry as well. So we can be proactive, several hours before we sleep. We wanted to make sure that we put on our atopic dermatitis medications and moisturizers and find ways to cool the head and neck skin during sleep. And this can be accomplished by a number of non-pharmacologic interventions. If you wanted to talk about it, I'm happy to share them with you.
I think that's a great segue, Vivian. Actually, now that we have a better background on what's going on with sleep and what the issues are, let's talk about what are the approaches to get better sleep. What do you do with your patients? How do you approach this conversation?
Yeah, every patient and family is quite different, but in general, we will start with non-pharmacologic management to improving sleep for the whole family. Some of the things, really simple things, is adjusting the environment. So nowadays, both kids and adults are on their iPhones and computers and iPads till the point before they fall asleep. And blue light that's emitted through these screens actually kind of tells the brain to wake up rather than going to sleep at night. So it's important that we kind of lower the light and the sound in the child's room at the bedtime and try to avoid using the screen an hour before bed and using that nighttime mode where the light is a little bit warmer rather than blue in color. Just simple things as in keeping the temperature cool will help decrease inflammation and itching. And a lot of the families with eczema children like to sleep together within the same bed. And that, although is, parents always think that, oh, I'm caring for my kid in close proximity, they're going to feel better. But studies have shown that increased physical contact through co-sleeping actually disrupts sleeps for both kids and adults in a family with atopic dermatitis. So these are the simple environmental adjustments that we can do to help with sleep. And
sort of good sleep hygiene for
that's totally, yep, exactly. And part of the sleep hygiene is trying to avoid naps during the day, because once we nap during the day, the whole cycle just gets disrupted. And also try to avoid caffeine after noon.
Now, what about the parents that say, it allows for better bonding when they sleep with someone else, or allows for better connections either with their siblings or there's many different cultures that do sleep together, or the parents want the kids with them, and they may view as putting a child away from everyone as a little bit foreign of a concept. What is your take on those kind of questions that might arise, or those kind of cultural inputs that you might have to take into account?
Yeah, that's a great point. What works for one family may not work for another family. Typically, when the child is young, there's a lot of co-sleeping that's happening in the house. And while that's physical contact has been thought to be helpful in bonding, co-sleeping increases body temperature for both the parents and also the child with eczema. And ultimately, that actually increases itching and skin inflammation and discomfort. If possible, it's okay to have physical contact and even sleep in the same room, but sleeping in close proximity within the same bed can be disruptive. And that's just what the study have shown. But, what works for one family, like I said, may not be applicable to another family.
And I really like how you discuss always the entire family, because it is a disease of the family.
Exactly.
But speaking of families, when families with kids who have eczema come to see me, we have so much to talk about. We have to talk about eczema to begin with, which is a concept that's sometimes hard to explain. And then we have to talk about all these habits that you need to change, how you're going to bathe, how you're going to moisturize. Then we have to talk about what kind of management you're going to use, what medications. When do you find it's a good time to talk about sleep? Because that does not strike me as the first thing that comes to mind. So how do you integrate that into the conversation? Do you feel like usually you do it in the first visit? Do you do it in the second visit? Is there a way you decide?
Yeah, I think sleep is one of the pillars of eczema management. I totally get it. Sometimes when we have a limited number of time during a clinic visit, especially when it's a new family, a new patient, you try to get everything in, use your topicals, bathing, moisturizer, all these things, and then we forget about sleep. So recently, I have kind of used sleeping pattern and quality as a yardstick on how well eczema is controlled for a patient and their family. And so there's actually sleep questionnaires one can do, and this can be easily done at the waiting room for a return or new patient visit. And that documents the sleep pattern, sleep duration, and how long it takes for the patient and the family to fall asleep. So if I see that sleep is disrupted, even though the skin looks great, I know there's something there. We have to treat the patient as a whole and not just their skin. So even if their skin looks not so inflamed and not so exacerbated that they're not sleeping, that tells us that the itch is still brewing, that the skin inflammation is there. And so we have to kind of be a little bit more aggressive in our management.
Yeah, I think surveys are such a great tool to use, not just to measure how the patient is doing, but also to start a conversation. So I really like that idea. Thank you.
Now, what are some pharmacological approaches that you might use? Because this is really great. You're talking about family dynamics, sleep hygiene. I love it. It really speaks to a holistic approach. And when it comes to the use of medications, what do you turn to and how do you approach that?
Yeah, pharmaceutical management is less studied in children with AD compared to adults. So some of these sedatives, tend to actually disrupt sleep pattern and sleep cycle. So we should use them with caution. But something that's pretty benign is melatonin. It is, a supplement that's been used for a long time. It's actually naturally produced by our body. And melatonin can actually, decrease sleep latency in kids. And there are varying doses for adults and kids. So that's kind of the first line sleep quote unquote medication that I start. With melatonin, one thing I do want to warn our audience is that it could lower the seizure threshold for kids with seizure disorder. So that's something to think about. Beyond melatonin, the most commonly used prescription medicine or over-the-counter medicine is probably antihistamines. especially first generation sedating antihistamines. That's very helpful to administer about 1 or 2 hours before bedtime. These are very helpful for the pediatric population, and some of them come in solution form. So in that case, we can use the solution according to a weight-based dosing for little people. Other than that, there are a number of things we can do, including mood medications that have sedative effects and even antidepressants. So sky's the limit, but just keep in mind that some of these have not been specifically studied in children, in elderly, and in folks with atopic dermatitis.
And I find that one of the tools that I really like to use for my kids with eczema, which I know you like that too, is the wet pajama technique, which for those who are not familiar with that, it involves using a wet pajama after applying your topical therapy and then applying a dry pajama on top of it, going to sleep. In addition to the therapeutic effects it has on the skin and on eczema, I can't not think about the cooling effect it has and how you talked about having just a cooling environment for when you go to sleep. So perhaps it's an additional mechanism that works. And I do know that parents tell me that when the kids do that, they actually sleep better. And I'm wondering if it's just the effect on the disease, or also effect on their sleep. So.
Well, Hadar, that brings up a really interesting point, because I think environment plays an important role. And I think when you do the wet pajama, I usually tell people lightly damp. I'm assuming you do the same. Hopefully it's not sopping wet, right? Or do you do sopping wet?
Yeah, no, we have to bring it. Yeah, absolutely.
The idea being you're controlling the local environment. So Vivian, what is the role of environment in helping with sleep? I mean, what about temperature? Or do you turn on the AC? Or do you put a humidifier in the room? What are those factors when you think about sleep?
Yeah, so the environment is more than just the ambient temperature. So we think about the clothing that we're wearing, something soft, something that's not rough. So we think about cotton a lot, but cotton actually becomes pretty rough after a few washes. And we always tell patients, well, not to use harsh laundry detergents and fabric softeners. So can you imagine a cotton shirt that really becomes crispy after a while? So alternative to cotton that kind of withstand wash is kind of like the bamboo fabric and rayon. They tend to be soft and better breathability. So those are the ones I recommend. I do recommend to avoid extreme temperature changes, dialing up and down the AC and or heater, because the temperature change really causes inflammation and itch on the skin. So I recommend maintaining a cool ambient temperature and lowering the lights and sounds of the room, and try to listen to relaxation music or even get a massage. Give a massage right before bed, because that can increase the blood flow and improve the overall skin condition. And also helps with bonding too.
Yes, that's chock full of great tips, information. Thank you so much. That was wonderful. And I do want to mention that actually we each practice in different environment. You're in Arizona, which is hot but pretty dry. And here I am in Miami, where it's very hot but humid. And I think we have probably slightly different recommendations. So certainly people listening, families who may be listening, think about where you are, talk to your practitioner and see how you can adjust and find the best way to get some sleep. But I'm going to tell you one place that the environment is going to be great, in Coronado Island, where we're going to hold our integrative dermatology symposium soon. And Dr. Shi is going to be there in person and speak more about atopic dermatitis and sleep, and be engaged with the entire community. So I'm looking forward to listening to that. And I think I want to thank you for just taking some time today to talk to us about sleep and eczema. That was wonderful.
Thank you for having me. It's a pleasure. I'm looking forward to the conference and hope to see you all there.
Thanks, Vivian.
Thank you for tuning into the LearnSkin podcast with Dr. Raja and Dr. Hadar. We would like to take this moment to tell you about our upcoming second annual Integrative Dermatology Symposium to be held at the Coronado Island Marriott in San Diego, California. This program is an educational experience jam-packed with information, including case-based discussions and multiple perspectives on topics such as psoriasis, atopic dermatitis, diet and skin microbiome, cannabinoids, hair loss, traditional Chinese medicine, and much, much more. Go to www.integrativedermatologysymposium.com and register today. We look forward to seeing you there.